Hi everyone, I'm Liz.
And I'm Lisa.
And we're part of the Med International team here in Lima.
So for this Med Talk, we're going to be talking about what happens after a service learning trip. But before we do so, we have some updates for you. So summer SLTs have been posted on our website, so please make sure to register soon. This summer, we will also be having 2 specialty SLTs from May 18th to 26th. They are the Development Corps and Dental Clinic. Both will be in Lima, so if you're interested, please feel free to check out our website or reach out to anyone on the MedLife team, and we'd be happy to help.
We're also having an exclusive high school trip this summer, so please, if you're a high school student or you know of any high school students that may be interested, go ahead and share that. That will be running this July, and you can reach out to the Med International team for additional information.
Keep in mind, we do have the referral program to help reduce trip costs, so if you know anyone that'd be interested in attending a service learning trip, please have them reach out to us.
And we're also asking for your new e-board information by May 1st, so please get that information to us as soon as possible.
And here are some exciting news and updates about Union Santa Fe. We're excited to share that we have exceeded our $30,000 goal for Union Santa Fe. Currently, we are working on the last panel for the retention wall. Once that panel is finished, the wall will be further bolstered by compacted rock and sand. Thank you so much for your hard work. Keep in mind, we're still accepting donations for Union Santa Fe in their journey to get land titles.
In Med Talk number 3, we talked about how MedLife staff, chapters, and communities prepare for a service learning trip. Today we're going to delve into the work that's done post a service learning trip. MedLife originated when Dr. Ellis saw firsthand the need for comprehensive and continuous care. Poverty is multidimensional, and understanding the complexities of the causes and possible solutions of poverty requires a sustained effort. Let's hear directly from Dr. Ellis about how the mission of empowering the poor in their access to health, education, and development came to be.
I'm here today to talk to you a little bit about really the difference between the MedLife mobile clinic model and the medical mission model that we kind of came out of. So when I graduated from McGill in 2003, I started working in Ecuador with some organizations that were doing really what I would consider is a medical mission. And essentially what that meant was a doctor from somewhere in North America, maybe Europe, coming down with a group of volunteers and providing free care to low-income people in Peru, Ecuador, other parts of Latin America. Part of what I saw was that the work wasn't all that comprehensive. And so people would fly in, they might do some surgeries for 5 days, but they would fly back out, and there was really no record of what surgery was done. If somebody had a post-op infection, there was nowhere to go. If somebody needed really a much more extensive workup, let's say they needed heart surgery, there was really no ability to do that. And so essentially what people could do is very basic surgeries, maybe hand out some amoxicillin, some Tylenol, and then they flew out. And the question that we had back then was there a way, given that there's so many people that want to help through this model of short-term volunteering, to make that a more sustainable effort? And at the time, we didn't really know if that was the case. We started with our first volunteer trip really of just 6 people, and during that we met a little boy named Darwin who needed heart surgery. At that time, much like many medical missions and much like doctors trained in the United States, we had no idea if you could even get a child heart surgery, open heart surgery, in Ecuador. And at the time, we didn't know how you would do that, how you would start that process, if there was insurance. And really, so at that time, we started playing with the idea of a patient follow-up program. And so what that looked like was working with Darwin and his family, going to the capital city, trying to find pediatric cardiologists, getting him the tests that he needs, and then seeing if there was a pediatric surgeon. And the answer to all of those questions was yes, all of that was available in Ecuador. And so we were able to provide really complicated care to a patient that lived in a rural area and had a very complicated disease. So there were a few issues there where the patients or the family didn't have enough money, and so they maybe didn't have enough money for transportation from the rural part of Ecuador to the city. They didn't have the money to stay in a hostel or get food or pay relatively small amount of money for a surgery. And so back in that time when we were doing this, I think we spent around $1,000 plus or minus some to get Darwin surgery, and that was housing his parents at a hostel and paying for food and buses. What the Ecuadorian government actually charged was really quite small. And essentially through that we had a proof of concept. We proved to ourselves that we could do this, that it was possible at the very minimum in Ecuador. And so we started to expand on that role. And so essentially what you see today in our mobile clinic model is screening for different diseases, whether that's cervical cancer, breast cancer, diabetes, hypertension, heart disease, lots of things. And then having our nurses go back into people's homes and feeding them through the established care that exists, so the Ministry of Health. And then as there's gaps within that care, if it's in transportation or food, or they need medications that's going to cost $500, MedLife fills those gaps and pays for the things that the government doesn't pay for. And in doing that, we don't replicate the system, we don't create a parallel system, we work within the established system of care, and we're just filling in the gaps and helping low-income people access the care that they need. So fast forward to today, and essentially what we did is we took that proof of concept back in Ecuador that we had, and we've tried to scale that operation. And so obviously it didn't make sense for me necessarily to be the nurse and go to everybody's home, so we've hired nurses. Our nurses come from the field, they come from places like Pamplona where we work, or Cebadas in Ecuador, and they're familiar with the regions where we work, the geography. They're also familiar with the healthcare systems and how to access them. And essentially what happens is the doctor flags a patient's record as needing more care. Our nurses then go to their house and they feed into the system that already exists. And there's a few different systems in every country where we work. Our nurses have become experts in figuring out which system a patient needs to go to, whether that's S-Salud, CIS, the military system. It all just depends on the patient's background. And then essentially what happens is the government provides certain level of care. So they'll pay for some medicines, some parts of surgery, but very frequently the patient has to pay something. And maybe that's $500, maybe that's $1,000. Maybe in some situations, in addition to that, they don't have the transportation, or they don't have the food, or they don't have the hotel that they need to come to the major cities and get the care that they need. And essentially what MedLife does is we fill that gap. And so if the government doesn't pay for the entire surgery, we then fundraise through our chapters and help pay for the surgery, or we help pay for the transportation, or the hotel, or the follow-up care. And so rather than creating a parallel system that duplicates everything that the national system already does, we work within the system that is already established, and we help fill the gaps that exist within that system and make sure that the patients that need the care get the care that they need. And that's essentially how our patient follow-up program works today.
MedLife at its core is a community development organization, and we understand that development is an arduous process that doesn't begin or end with a service learning trip. Our MedLife staff works year-round to fulfill our commitment to high-quality care. That may include visiting patients that are enrolled in our patient follow-up care program, visiting past projects, doing monitoring and evaluation, or meeting with local officials and advocating for those who are most in need. We strive to empower the communities that we work with, and that is a process that doesn't end with the last day of a service learning trip. One of the key ways that MedLife ensures quality care for its patients is through our patient follow-up care program. Here's a little bit more information about how our patient follow-up care program works.
Buenas tardes, soy el Dr. José Rodríguez, soy médico de MedLife, soy médico de las clínicas móviles y también soy el encargado de evaluar los seguimientos. Seguimientos es un programa que tiene ya 10 años en MedLife. Comenzamos trabajando con pacientes que eran recomendados por ciertas personas, sobre todo líderes de comunidades. Nos avisaban sobre pacientes con problemas, sobre todo en condiciones de mucha pobreza. Después, cuando iniciamos las campañas en MedLife, cada campaña, cada médico recomienda a un paciente para seguimiento. ¿Cómo lo recomienda? Primero por una patologías que son de moderada gravedad y que tienen alguna posibilidad de recuperación rápida, sobre todo pacientes que sean jóvenes, niños en su mayoría. Entonces, si tenemos la posibilidad de recuperar la salud de un niño o de un joven para que tenga una vida más útil, es el mejor criterio para poder incluirlos al programa de seguimiento.
Med program staff is constantly visiting communities, not only to visit patients, but also to monitor and evaluate past projects. This gives communities the opportunity to propose new projects, voice any ideas or concerns, and connect MedLife with potential new local partnerships. Haiti, our MedLife Cusco director, is now going to talk about the importance of building relationships with the communities and how that work goes way beyond just the week of a service learning trip.
Once we finish with mobile clinics, our team in Cusco and in all of our sedes, we work with basically with our follow-up program. We gather the information that we obtained during the mobile clinic season. We enroll the patients in our follow-up program, and we visit every family, and we keep the record of all the patients that we have found during our mobile clinic season. Finally, it's important also to mention that we work with local governments, municipalities, in order to coordinate future mobile clinics. We establish the places where we have been working in the past season, and we decide if we are going to go, if we need to continue working with the same communities or if we need to explore new ones. So it's important to emphasize the work that we do. It's not only us, we work with the Ministry of Health, we work with local governments, communities, leaders. So this is going to give sustainability to the projects that we are going to establish.
Now that we've heard about the work that's done after an SLT within our communities, let's hear from execs from our different chapters on what they do in their respective communities back at home.
Hi, my name's Justin. I'm from the University of Nebraska-Lincoln MedLife chapter. This week we went to Lima, Peru. And I think there's a lot of things that are important to do when it comes back to taking what you do on a service learning trip back to your chapter. The first thing is definitely retaining that sense of community you get while you're on a trip. I think while you're here, you meet a lot of new people and it's super exciting, but bringing that back with you and maintaining that involvement with those members is super important. So I know we do a lot of social events, a lot of fundraisers at different restaurants. I know a lot of them will donate part of the night's proceeds toward MedLife. So we kind of combine social with philanthropy in the sense that we're raising money, but we're also kind of hanging out and you know, talking about MedLife and keeping that perspective that we've developed here. Another big thing that we like to do is maintaining that volunteering aspect through local nonprofits, such as I know there's a few local clinics that we help. Sometimes we provide resources for them, such as we make blankets and other certain things. And other times we just go volunteer and, you know, make our presence known and kind of help run the clinics there back locally, because it's important to take, you know, what you've learned here and that perspective you gain and apply it to where you're from and bring it back home to ultimately, you know, the United States.
Hi, we're from the University of Illinois at Urbana-Champaign. My name is Preeti Narayanan and I'm the treasurer.
And my name is Parisha Sangani and I'm the director of communications.
So usually after the service learning trip, we go back to Champaign and we continue doing local work around our community. So for example, we tutor emergent bilinguals, so we help them get more fluent in English as well as develop their Spanish speaking skills.
And we also tutor those who have English as their second language, specifically adults, so they can find good job opportunities.
And in addition, we also help serve free meals at our local church.
We also volunteer at the different hospices around our community.
And this year, our big event is going to be involved with autism awareness. So we're going to be doing workshops about awareness and handing out shirts and having a big event in our university. And last but not least, we've already started fundraising for the next service learning trip, and we'll be working on spreading the word, hopefully getting even bigger turnout for next year. And yeah.
It's important to continually engage members after the service learning trip, because although it is great, individuals want to volunteer internationally, it's important to recognize that there are social issues back home. Volunteering in your local community and partnering with other organizations on larger projects are a great way to stay involved. We also asked Nima on what she thought would be great ways for students and volunteers to do after the service learning trip to continually support the MedLife movement.
Hi, I'm Nema Limo. My message to MedLife movement is that I'd like to encourage more people to sign up for the service learning trip so that we may be able to save more people, because by you guys signing up for the service learning trip, we are able to help many people. We are able to work with schools by providing them with clean bathrooms. Also, we are able to do patient follow-up. So when you sign up for these service learning trips, I'm sure that you'll be able to save more people than the way we are doing it right now. So please sign up as many as you can, encourage your friends, tell your neighbors to sign up so that you can save the world together. Thank you.
The service learning trip isn't the culmination of your med life experience. Rather, it's just the start of being more involved and continuing the movement. So we encourage you all to take action both in the global and local community.
Thank you guys for tuning in to Med Talk number 5. We look forward to seeing you next month for the last Med Talk of the year.
Bye.
Bye.